begin.
Hello everyone, and welcome to part 1 of Acupuncture, the Coronavirus, and Hypertension. Now I've been bombarded with requests as to if and when I plan to do a series on the coronavirus and hypertension. So finally, here you are. I will say I've received many calls from some of my hypertensive patients who were concerned about the severity of the outcome if they were to be infected by this virus. I'd always and will continue to recommend everyone affected by this chronic illness consult with your primary care physician to discuss precautions in which you can take to better protect yourself. I've actually experienced 2 separate instances where 2 of my existing patients, hypertensive patients, were doing bad as a result of becoming infected by this virus, and at their request, I put them on an herbal formula, and thankfully, they recovered pretty quickly, in which, of course, I was excited to hear. Now, I've actually read reports that it reported that individuals diagnosed with hypertension have a higher risk of severe illness with COVID-19, as well as a higher chance of actually dying from it. What concerns me most about individuals with hypertension are the ones who are 50 years of age or older. They face an even more increased risk of severe symptoms if they were to become infected by this virus. Now, most also tend to have other pre-existing conditions such as chronic lung disease, serious heart conditions, obesity, diabetes, chronic kidney disease, as well as liver disease. Now, for older individuals suffering from one or more of these conditions, a healthcare professional is usually aware that the individual has a compromised immune system, which of course would make it more difficult for them to naturally fight off a virus. Now, any type of infectious disease along with improperly managed hypertension can take a serious toll on an individual's immune system. An interesting note is that nearly 2/3 of individuals over 60 years of age have high blood pressure. Although pneumonia is usually considered the more common complication of this virus or of a virus, studies have shown it damages the cardiovascular system. Now, as I've discussed in my episode on acupuncture, the coronavirus, and multiple organs, hypertension also severely damages the arteries and reduces blood flow to the heart. The coronavirus, as a result of a cytokine storm, does damage blood vessels as well, which forces the heart to work much harder to pump enough blood. Now, over an extensive period of time, the extra work placed on the heart tends to weaken the organ. Now, past studies have shown that people with heart disease who become infected by some form of respiratory illness, let's say such as a flu, are at a higher risk for heart attack. Now, I'm sure you know that I've been asked as to how an acupuncturist would diagnose and treat hypertension from a Chinese medicine perspective. Now, when it comes to traditional Chinese medicine, hypertension is broken out and differentiated based on treatment as to either headache, dizziness, tinnitus, and palpitations. Now, with this incidence being based on contributing factors such as emotional stress, which is in Chinese medicine related to liver qi stagnation with liver yang rising. You see, stagnant liver qi tends to turn into fire, which ultimately exhausts liver yin. Now, when liver yin is deficient, there's nothing left to restrain liver yang, and liver yang would rise up to the head where all the yang channels meet, which in this case wouldn't be good. Now, another contributing factor would be improper diet. As I've stated as a contributing factor in many disorders, because as the saying goes, you are what you eat, in this case, eating lots of greasy and sweet foods injure the spleen and stomach, which is responsible for your postnatal qi. And bad foods tend to generate damp turbidity. Now, when damp turbidity accumulates, it tends to transform into internal heat, leading to disruption of the ascension of clear yang and the descension of turbidity. Now, the next contributing factor would be kidney essence deficiency, whereby kidney essence would fail in this case to generate marrow. Now, overall disequilibrium of yin and yang would present as a result of these stated contributing factors. Now, let's look to analyze the primary symptoms in which I stated earlier. Now, both headache and dizziness can present as primary symptoms together or by themselves. When it comes to tinnitus, complications of hypertension can present as or with auditory disturbance. Tinnitus is viewed in traditional Chinese medicine as either pathogenic heat covering the orifices or as deficiency of kidney essence. Now, with regard to palpitations, which as a symptom generally presents during the latter stages of hypertension as a result of complications of the cardiovascular system and cardiovascular pathologies. In this case, when hyperactive liver yang with internal heat disturbs the mind, there would be symptoms of palpitations accompanied with difficulty falling asleep at night and irritability. Now, palpitations in traditional Chinese medicine and cases relative to hypertension can be diagnosed as phlegm-damp obstruction causing the yang in the chest to become inactive. Now, in my next episode, I will go over the basic patterns of hypertension in Chinese medicine. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?